So the question is, what is the most common untalked about side effect of Ozempic? Well, the most common untalked about side effect of Ozempic, or in our practice, tirzepatide, would be the fact that it may affect the effectiveness of your oral contraceptives for at least the first 4 to 8 weeks that you start using that peptide for weight loss. And I think that probably the thing that most people haven't been told is that if you're trying to not have a baby and you start on a GLP-1 agonist for at least the first month and maybe longer, you need to add barrier contraception to your protocol if you want to not get pregnant. I think it's a mistake to not talk about that, and could maybe come as a little bit of a shock. It's like when a woman takes an antibiotic and it can affect the effectiveness of their birth control. That's just as common with Mounjaro, Ozempic, tirzepatide, semaglutide as it might be with certain other macrolide antibiotics. So I think that if you're new to weight loss arena, or if you've been recently started on Ozempic or Mounjaro, tirzepatide, the peptide therapy, GLP-1 agonist for weight loss, from a contraceptive standpoint, you might want to know that your oral contraceptives may not be as effective as they have been for you in the past. The concept of fertility is a little bit more all-encompassing than that, certainly, because obesity by itself can limit your fertility, which means that with obesity, your oral birth control may have not been the only reason you weren't getting pregnant. Obesity by itself is a fairly limiting component of fertility. And with weight loss, your body may become more fertile. And that's really well published in some studies, is that there's not that secondary estrogen conversion. So as you start losing weight, you may become more fertile just from the weight loss. I do think that that's an important component of overall health and wellness. People that are healthy are more fertile. And so you might want to pay a little bit of attention to your birth control while you are in a weight loss program, especially if it involves the GLP-1 agonists. As always, we're brought to you by the Zero Downside podcast. I hope you check us out on all the different platforms. I'm Dr. Wade McKenna. We're presented by MoabTexas.com. Please hit the like and subscribe button. Thank you for your attention.